Hi everyone, and welcome to this week's episode of Tubules Live. Today we are very privileged to have Dr. Omar Ikram with us, who's flown all the way from Australia. So welcome to Tubules Live.
Thanks very much.
Give us a little bit of background about yourself. Where did you do your dentistry training? And you are an endodontist specialist, so where did you do your postgraduate training as well?
Okay, I did my undergrad training in the far south of New Zealand. I was actually born in South Island, New Zealand, Christchurch, where they're having all the earthquakes at the moment. But I did my training as an undergrad at Otago University before moving back to Christchurch to do some general dentistry. Then I went over to the UK over here, and I did some training in endo, obviously, but I did a lot of general dentistry while I was here as well. So I probably spent about 10 years of my career doing general dentistry before I did my endo specialty at King's.
Sure.
Currently I'm at Specialist Endo Crow's Nest in Sydney's North Shore.
Okay. So you were in London for quite a while. Do you miss it now that you're back home, or?
Well, it really feels since I've been here that I haven't really left the place. There's never a dull moment here. You know, the weather's raining and warm at 1 minute. It's 4 seasons in a day, double-decker buses and all that sort of stuff. It's been great to be back, but I'm missing the gang back in Australia, obviously.
Definitely. Okay, so what's your talk about today?
Today's talk is about calamities in endodontics. It's a talk about cases that may have gone wrong or not in an ideal way. The idea is that clinicians can look at the talk, take out what they can out of the errors and maybe stop making the errors themselves, learn from mistakes of others. It's a very good idea to do that.
Okay, so I think it's going to be a very, very useful talk to everyone today. But before I hand over to Omar, can I just say that if you have any questions, which I'm sure you do, please do send them in the box below. Send them as soon as you think of them, because we're probably going to have lots and lots, so we'll just take the first couple of ones that we get. Also, don't forget CPD is on this side, so make sure you answer all the questions at the end, and you will get your CPD questions and your certificate as well. Okay, so without further delay, it gives me great pleasure to now hand over the floor to Dr. Omar Ikram to talk to us today about endodontic calamities.
Hi everyone, today's talk is going to be on endodontic calamities. How can I get myself out of this mess? You may or may not know that I run a Facebook site. Lots of people here tonight are actually from that site. People online may be watching. If you'd like to join up, the Facebook page is called Specialist Endo Crow's Nest, and you can get the tips and hints and clinical ideas of everything that I think about at the time of the day in endodontics. Sometimes when I do my teaching at the dental hospital, I put stuff down on there, and you'll get all the posts. The other thing I use is Twitter, @SpecialistEndo. So there's aims and objectives with this talk, because it's a CPD talk, so we'll go through those briefly. First of all, one of the aims of the talk is to gain an understanding of the literature with regards to treatment of iatrogenic areas in endodontics. So although we go on about studies a lot, I try not to bog you down with too much literature, but basically the idea is to get some background on how to correct these problems based on actual science. Also to achieve an insight into the possible preoperative situations may warrant caution. So that means basically when you see a case, maybe something that you think about, you can take away from this talk is perhaps you see something that might happen in the future and say, okay, maybe I should refer this, or maybe I should take it slowly on this case because of what Omar showed me in his talk. The other one is to be able to understand the iatrogenic complications and how they affect outcome, because patients really want to know how it's going to affect the outcome if the iatrogenic area occurs. They don't really want to just hear the tooth's going to be extracted. They want to know why and how long is it going to last and that sort of stuff. So that's hopefully something I'm going to touch on a bit tonight. And also obviously gain some tips in order to make your treatment much easier of certain cases. So these are the sort of essence of my Facebook page, clinical tips on how to help you out of difficult situations. So it's all going to be packed into one fun hour. A quote for the day. I usually do these when I do a presentation. The idea is that you take something away from the talk and it sort of reminds you of what the talk was all about. So my Zen proverb is, a smart man learns from his mistakes, but a wise man learns from the mistakes of others. We all learn from our mistakes in life, but a wise man learns from the mistakes of others. What that really means is that, of course, we're looking at cases that other people have made errors on, and hopefully today we can become wise people. So I've got some cases here. These situations depend on what you think of them. For example, do you think that case is close to the ID canal, and are you worried about going through there and giving the patient a numb lip, or do you just think it's a really nice curve? It depends on what you look at really with this case. So are these complications really to happen, or are they just pretty pictures? Here's another one. Maybe the curve of that tooth is quite severe and you might have worried about that. This depends on what you are thinking about with regards to these. So iatrogenic areas can occur in any time in endodontics, so it's just good to be mindful of that before you set out on the case. So an endodontist nightmare. This is my daughter. She's not an endodontist nightmare, but apparently people tell me that she looks a lot like me, and she's making a facial expression which looks very surprised. So this is what I look like when I get a case like that referred through the door. Obviously, the treatment's been done a while ago, actually. Not too far away from here, actually, the treatment was done. This patient came in, saw me in practice, and they had about a survival rate of 12 to 13 years for that tooth. So when you talk about survival in endodontics, we're looking at totally different criteria to success. This case is not a success. It's got endodontic disease, it's got perforation, it's got periodontal disease, but it is a survival case. So when you read those studies on survival, be very careful on the interpretation of what is the survival of a tooth. So it's not only endodontists who have nightmares at night, prosthodontists. We get quite a few cases like this referred into us at the dental hospital in Sydney where I work. Patients obviously gone off to their favourite hometown country at some stage and had a mouthful of crowns, and they come back to you and say it hurts on the lower left there somewhere. So diagnostic errors can happen here, and also difficulty with treatment planning. So the first case I'm going to show you today is a very interesting case which recently came into me. So you see this tooth, 1-6, upper right first molar, and you look at it and you go, if that was my first endo I've ever done, I'd probably be like, oh, well, I've filled all 3 canals to the apex, so what's the problem? Well, what we know that with this case is that there's disease around the apex, and we know that this patient had this treatment done more than 5 or 6 years ago. So when we look at a case like this, we're actually looking at how long the treatment was done, what time, because if